Hello students, I am Dr. P.I. Nainan, Assistant Professor in the Department of Oral and Maxillofacial Surgery, teaching at Vinayaka Mission's Shankaracharya Dental College, Salem. I am here to teach you the topic Sterilization and Asepsis. Coming to the history, Joseph Lister gave the first study on the prevention of wound infection, which was carried out between 1865 to 91. He carried out work on antisepsis, initially using phenol for contaminated wounds and later applied it for all surgical wounds, also in the OT room by nebulization of the solution. Coming to the various definitions, we have cleaning and antisepsis among them. Cleaning, it is a process which removes visible contamination but does not necessarily destroy microorganisms. It is a necessary prerequisite for efficient disinfection or sterilization. Coming to antisepsis, it is a procedure of application of an antiseptic solution or an agent which inhibits the growth of microorganisms while remaining in the contact with them. Coming to disinfection, it is a process which reduces the number of viable microorganisms to an acceptable level but may not inactivate some viruses and bacterial spores. Coming to sterilization, it is the process of destruction or removal of all microorganisms from article, including spores, viruses and fungi. Coming to the Center of Disease Control or CDC and the OSHA, that is Occupational Safety related dental guidelines for sterilization of instruments, as per May 28, 1993, the instruments are classified into three categories, mainly critical, semi-critical and non-critical. The critical instruments are surgical and other instruments used to penetrate soft tissues or bones and are classified as critical and should be sterilized after each use. These devices include forceps, scalpel, bone chisels and burrs as in the picture. Okay. Coming to semi-critical, instruments such as mirrors, retractors that do not penetrate soft tissue or bone but contact oral tissues are classified as semi-critical. These devices should be sterilized after each use as well. However, sterilization, if it is not feasible because the instrument will be damaged by heat, the instrument should receive at least a minimum high-level disinfection. Coming to non-critical, instruments or medical devices such as external components of X-ray heads that come into contact only with the intact external skin are classified as non-critical. Because these non-critical surfaces have a relatively low risk of transmitting infection, they may be reprocessed between patients with intermediate level or low level disinfection or even a detergent or water splashing or washing, depending on the nature of the surface and the degree and nature of the contaminant. Coming to regulations for the methods of sterilization, instruments that come in contact with oral mucous membrane should be sterilized after use, preferably by autoclaving. All instruments should be thoroughly cleaned before autoclaving. Heat stable instruments must be routinely sterilized after use by autoclaving. Heat sensitive instruments and equipment must be sterilized or disinfected chemically. The instruments that are stored should be sterilized in sterile packing that is approved for this purpose and correctly sealed to maintain the sterility. High level disinfection is undertaken by immersion in 2% glutaraldehyde solution for 10 to 30 minutes. Chlorine based products may be used to disinfect surfaces and instruments, particularly in case where other methods are not suitable. To achieve sterilization of any instrument, three definite stages are to be completed. First is the pre-sterilization cleaning, second is the sterilization process, and the third is the aseptic storage. All three components are important. Coming to pre-sterilization cleaning, the objective is for the removal of the organic matter, which could be blood and saliva, which provide protective barrier for microorganisms and prevents its destruction. There are three methods of cleaning. One is manual, second is ultrasonic, third is mechanical washing. Manual cleaning, it is the simplest and cheapest method but time consuming, and it is difficult to achieve as well. One requisite is that heavy duty gloves and glasses must be worn to protect you. You need to protect yourself from needle stick injuries as well as to protect your eye as well, correct? The materials used for manual cleaning are soaps and detergent. Coming to ultrasonic cleaning, the principle is the conversion of electrical energy into vibratory sound waves. which pass through a soap solution containing the instrument. It is usually called a biosonic solution. It is used mainly for burrs, bone files, bone saws, artery forceps, saws, etc. Okay. Coming to mechanical washing, the principle, it is a squirting of high pressure jets of water with or without a detergent which removes debris from the instrument. Small instruments like burrs, blades are not suitable for this type of cleaning. So you prefer a ultrasonic cleaning for those instruments. Coming to the sterilization process, the classification of the method of sterilization: A, you have physical, you have sunlight, drying, heat which could be dry or moist, filtration, gas, irradiation and ultrasonic cleaning. Coming to chemical, you have phenol derivatives like phenol, cresol, resorcinol. Coming to oxidizing agent, you have potassium permanganate, hydrogen peroxide, etc. Halogens, you have iodine, chlorine. Bicarbonate, you have chlorhexidine. And quaternium ammonium salts, you have cetramide and zephyrin. Again, you have other chemicals like alcohols like ethanol, isopropanol, aldehydes like formaldehyde, glutaraldehyde, acids like boric acid, acetic acid, metallic salts like silver nitrate, zinc sulfate, etc. Dyes like gentian violet, acryflamin, proflamin, and furan derivatives like nitrofluorazone. Heat is the most common and one of the most effective methods of sterilization. The factors influencing sterilization by heat are the nature, which could be dry or moist, the temperature and time for sterilization, the number of organisms present, whether the organism has a sparing capacity, and the type of material from which the organism is to be eradicated. Coming to sterilization of packaging materials, the type of sterilizer and the packaging materials are important to notice. From this, for steam, you can use to sterile nylon, plastic, cloth tubing, biofilm or paper peel pouch. For chemical vapor, you have sterilization paper wrap, biofilm and paper reel pouch. For dry heat, you have nylon, plastic tubing and foil. For dry heat, killing is due to the protein denaturation and the toxic effects of elevated levels of electrolytes. For red heat, it is used to sterilize metallic objects by holding them in flame till they are red hot. Example, inoculating wires, needles, forceps, etc. can be sterilized this way. Flaming, the article is placed over a flame without allowing it to become red hot. That is the main difference between both. The example is glass plates, cotton wool and glass slides. Coming to hot air oven, these are all so far what we covered is dry heat. Okay. Hot air oven, it is used to sterilize instruments which do not get damaged by high temperature, such as laboratory glasswares, flasks, scissors and all stainless steel instruments with a sharp cutting edge. Even BP handles, dampened dishes, mouth mirrors, etc. Hot air is a poor conductor of heat and has poor penetrating capacity. So grease, oil, powder, plastic, rubber containing substances should be sterilized by other methods. High temperature can damage fabrics or melt them, so you need to be careful. Temperature and time, the sterilization is complete if there are two factors achieved throughout the load. So as you can see in the slide, these are the indicated temperature for using a hot air oven. For 160 degrees Celsius, you give it for 120 minutes or 60 minutes. 170 degrees Celsius for 60 minutes, 150 degrees Celsius for 150 minutes and 140 degrees Celsius for 180 minutes. So as the temperature goes down, the time taken for sterilizing increases. Coming to sterilization control of the hot air oven, the spores of non-toxic strain of Bacillus subtilis and Clostridium tetani are used as a microbiological test of dry heat. Even Brown's test tip is available that contain a chemical indicator of sterilization. Coming to glass bead sterilizer, this method employs a heat transfer device. The media used are glass beads, molten metal and salt. The temperature achieved is of 220 degrees Celsius. This employs submersion of small instruments such as endodontic files, burrs, etc. into the beads and are sterilized in 10 seconds provided they are clean. A warm-up time of at least 20 minutes is recommended to ensure uniform temperatures in these sterilizers. Coming to moist heat, it is effective by denaturation and coagulation of proteins. Pasteurization, the temperature employed for this technique is either 63 degrees Celsius for 30 minutes or 72 degrees Celsius for 15 to 20 seconds, followed by cooling quickly to 13 degrees Celsius. The method is used to heat sensitive liquid and pharmaceutical products. There are two types of pasteurization techniques, which are batch method and flash method. Coming to tintilization, this method is used for some heat sensitive liquid. You give an exposure of 100 degrees Celsius for 20 minutes for 3 successive days. Autoclave, Autoclave is working under the principle of steam under pressure. So now what we are talking about since the last three methods are steam or moist heat type of sterilization. Okay, it's a recall. So coming to autoclave again, it works under steam under pressure. The principle is basically when water boils, its vapor pressure equals that of surrounding atmosphere. Hence the vapor pressure inside a closed vessel increases, then the temperature at which water boils also increases. Therefore, the saturated steam has a greater penetrating power. In simple terms, it's basically the same as how a pressure cooker at home works. Okay? The cycle is a 15 psi or pounds pressure at temperature of 121 degree Celsius for 10 to 12 minutes or 30 pounds pressure at 134 degrees Celsius for 3 minutes. This is flash sterilization. Okay? To avoid or minimize corrosive action of steam on metals, ammonia is added to the autoclave or a 2% sodium nitrate is also effective. For determining the efficacy of moist heat sterilization, spores of Bacillus stereothermophilus are used as test organisms or chemical indicator. Autoclave tapes and thermocouples can also be used. Sterilization by steam under pressure can be carried out at temperature between 108 to 147 degrees Celsius. Dressings, instruments, laboratory ware and the media can be stored. The types of sterilizers are lab autoclave, hospital dressing sterilizer, bowl and instrument sterilizer and rapid cooling sterilizer. You have simple autoclave which could be vertical or horizontal. It could be a cylinder of gunmetal. The lid door fastened by screw clamps and made airtight by asbestos washer. On its lid there is a discharge tap for airstream discharge, and it has a pressure gauge as well as a safety valve. The water is put in the cylinder and the material to be sterilized is placed on the tray and heating is started. The lid is screwed tight with the discharge tap open for the initial air escape. The steam air mixture is allowed to escape freely till the air is displaced out of the autoclave. So you use it in a vacuum condition. When steam pressure rises and reaches its desired level, the safety valve opens and excess steam escapes. The holding period is calculated and heater is turned off, and the autoclave is allowed to cool till pressure gauge indicates atmospheric pressure. Only then you open the machine. The disadvantages: you have method of air discharge which is inefficient, and it is difficult to decide when the discharge is fully complete. So no facility of drying the load after the sterilization and before taking out is also there. Steam is the effective means of sterilization because of its high penetrating capacity, as well as it gives large amount of heat to the surface which it comes in contact with. Coming to temperature, pressure and time which could be used for autoclaving. So already I had mentioned temperature and time two sets previously. Again I am repeating some measurements for dressing wrapped in equipment, glassware as well as instruments which could be metal. So for dressings you can give it at 121 degrees Celsius with 15 pounds pressure for 30 minutes or 132 degrees Celsius and 27 pounds for 15 minutes. Glassware again you have the first set for 15 minutes and the second set for 3 minutes. Instrument metals you have the first set for 15 minutes and the second set for 3 minutes again. For suture material and tubing, first set is for 20 minutes and second set is for 10 minutes. For linen packing, first set is for 30 minutes and the second set for 10 minutes. In the treatment tray you have first set for 30 minutes and the second set for 15 minutes. Coming to sterilization control of the moist heat, the spores of Bacillus stereothermophilus are used as the test organisms. Its spores require an exposure of 12 minutes at 121 degrees Celsius to be destroyed. Brown's test strip are used as chemical indicator of moist heat. Coming to irradiation, it is used for sterilization of two types. One is by ionizing radiation and the second one is by non-ionizing radiation. By ionizing radiation, use X-rays, gamma rays and high-speed electrons. For non-ionizing radiation, use UV rays and infrared rays. These forms of radiation can be used to kill or inactivate microorganisms. In ionizing radiation, it is effective for heat labile items. It has great penetrating properties. It is commonly used in industries to sterilize disposable materials such as needles, syringes and swabs. The lethal action of this radiation is believed to be due to its effect on DNA of nucleus and on the other vital cell components. There is no appreciable rise in temperature. High energy gamma rays from cobalt-60 are used to sterilize such instruments. Coming to non-ionizing radiation, two types of non-ionizing radiation are used for sterilization. They are ultraviolet. This is absorbed by proteins and nucleic acids, and it kills microorganisms by its chemical reactions it sets up in the bacterial cell. The bactericidal range is 2400 Armstrong to 2800 Armstrong, used mainly for air purification and water purification in hospitals. Coming to infrared, it is most commonly used to purify air, such as in the OT. Infrared is effective, however, it has no penetrating ability. Coming to ETO or ethylene oxide gas sterilization, the mechanism of action, it destroys microorganisms by alkylation and cause denaturation of the nucleic acid of microbes. It is an excellent sterilizer of heat sensitive items like plastics, rubber and photographic equipment, which could be sterilized by this method. It is also used for mass sterilization of disposable items like plastic syringes, needles, catheters, blades, etc. It is highly toxic, inflammable and carcinogenic, so should not be used when heat sterilization of an object is possible. Sterilization by low temperature steam and formaldehyde. This method uses a combination of dry saturated steam and formaldehyde to keep bacteria, sores and most viruses. Destruction of microbes is due to dual action, that is by heat and by the formaldehyde chemical property. The required combination of temperature and pressure is 127 degrees Celsius to 132 degrees Celsius at 20 to 40 pounds for 30 minutes. It is suitable for heat sensitive material and instruments like rubber and plastic material, and it requires provision for adequate ventilation to expel chemical vapors released from the chamber. Coming to a new low temperature sterilization technique, you can use hydrogen peroxide in a plasma sterilizer. Based on a patented process involving the generation of a low temperature hydrogen peroxide gas plasma, it effectively sterilizes most heat and moisture sensitive medical devices and surgical instruments like rubber catheters, gloves, plastic syringes, etc. Only disadvantages of this technique is its cost, so it cannot be used as a routine sterilizer. Coming to aseptic storage, the pattern of storage varies from place to place. They are either stored in drawers or in containers, in packs or sterilized trays. The maintenance of sterility during transportation and the storage is of utmost importance. The packs should be stored with following considerations. The instruments are wrapped until ready for use. To reduce the risk of contamination, the sterile packs must be handled as little as possible. The packs should be allowed to cool before storage, and otherwise condensation will occur inside the packages. To prevent contamination from rodents, ants and cockroaches, the storage area must be subjected to adequate pest control. It should be stored at least 8 inches above the floor and 18 inches from the ceiling. The sterile packs must be stored and issued in correct date order. The packs preferably are stored in drums which can be locked. Preset trays and cassettes are useful as the instruments can be organized as per procedure. Coming to fumigation of the operating theatre or OT, fumigation is achieved by fumigator and potassium permanganate reaction technique. The chemical used is 40% formalin. Factors influencing the fumigation of the theatre: you have relative humidity, which plays a major role. A minimum of 70% is essential. Water used in fumigator with fumigant helps to achieve and maintain humidity. Coming to temperature, it requires effective temperature of 30 to 40 degrees Celsius for effective fumigation. Formaldehyde levels in the air and in the OT. The dose of formalin is usually decided by the size of the room. As a rule, 180 ml is used for a room of size 1000 cubic feet. Coming to chemical methods, they are used to disinfect the skin of a patient prior to surgery. This is also to disinfect the hands of the operator. No available chemical solution will sterilize instruments immersed in it. Secondly, there is a risk of producing tissue damage if residual solution is carried into the wound while it is being used. Coming to resistance of the microbes, you have bacterial endospores, mycobacteria and tuberculi, small non-lipid viruses, fungi, medium lipid viruses, vegetative bacteria with increasing resistance. Coming to mechanism of action of chemical disinfectants, you have mechanism of action of most chemicals which are non-specific and complex, but most of them affect microbes by one of the following mechanisms. First one is cell membrane injury, second one is coagulation and denaturation, third one is interaction with functional groups of proteins. Coming to Spaulding's 1972 classification of chemicals, chemicals are classified as high intermediate and low level disinfectants based on their effectiveness and contact time of the solution as well as the biocidal activity of the agent against bacterial spore, Mycobacterium tuberculi as well as vegetative bacteria. Coming to high level disinfectants, the chemical which have active resistance to bacterial spores and all microbe forms are called high level sterilants. Ethylene oxide gas and immersion glutaraldehyde solution are high level sterilants. Prolonged immersion of 6 to 10 hours are required to achieve sterilization with 2% and 3.2% preparation respectively. Coming to intermediate level disinfectants, these chemicals may not inactivate bacterial spores during routine usage, but they do destroy other forms of microbes, particularly tubercle bacilli. Formaldehyde, chlorine compounds, iodophore, alcohols and phenolic compounds are these type of disinfectants. Coming to low level disinfectants, these provide narrowest microbial range and include quaternary ammonium compounds, simple phenols and detergents. Such material are used for cleaning purpose, but their microbial activity is too low to consider them as disinfectants. Coming to EPA and ADA classification of chemicals, you have disinfectants or sterilants. These are used for sterilization of high level disinfection depending on the contact time. Coming to hospital disinfectant with tuberculocidal activity used to achieve intermediate disinfection. Non-tuberculocidal hospital disinfectants used to achieve low level disinfectant, and sanitizers. Use of chemicals that maintain the microbial flora at a safe public health level. This chemical has no application in dentistry. Coming to aldehyde compounds, they are aqueous solution of formaldehyde or glutaraldehyde which are effective disinfectants. Coming to formaldehyde, it's a broad spectrum antimicrobial agent used for disinfection. It's a hazardous substance, inflammable and irritant to the eye, skin and respiratory tract. This is used up to 50 degrees Celsius and has limited sporicidal activity. It is used for large heat sensitive equipment such as ventilators and suction pumps, excluding rubber and some plastics. Coming to glutaraldehyde, it is toxic, irritant and allergenic. It is a high level disinfectant. It is applicable where heat cannot be used. It is active against most vegetative bacteria including Mycobacterium tuberculosis and other viruses including HIV and HBV, fungi as well as bacterial spores. It is frequently used for heat sensitive material. A solution of 2% Cidex requires immersion for 20 minutes for disinfection and 6 to 10 hours for sterilization. Stonell reported that glutaraldehyde kills vegetative bacteria, spores, fungi and virus by alkylation on a 10-hour contact. The CDC includes it in the list of effective agents against hepatitis virus as well. It is also toxic and irritating and hence not used on certain surfaces such as furniture, walls and floors. It can be used safely on metal instruments for less than 24 hours or rubber or plastics and even porcelain. Coming to alcohols, ethanol and isopropyl alcohol are frequently used as an antiseptic. Alcohol possesses some antibacterial activity against some gram-positive and negative bacteria, especially against Mycobacterium tuberculosis. Solution of 70% of alcohol are more effective than higher concentration as the presence of water speeds up the process of protein denaturation as reported by Lawrence and Block. The alcohol do not function as disinfectants when instruments, handpieces or other instruments are simply wiped with them since they evaporate quickly. Alcohols can dissolve cement holding instruments together and plastics may harden and swell in their presence. They are frequently used for skin antisepsis prior to needle puncture. The alcohol must have a prolonged contact with the organism to have an antibacterial effect. This contact is prevented due to its rapid evaporation. Alcohol is sometimes used as a rinse following a surgical scrub on the site. Its effectiveness lies in the solvent action and not in its antibacterial property. Coming to ethanol, it is employed in a concentration of 70% as a skin antiseptic. It has a poor activity against bacterial spores, fungi and viruses. It is used in concentration of 60 to 70% volume by volume for disinfection of skin. The alcohol do not have reliable sporicidal, virucidal or fungicidal action, hence they are not useful for sterilizing surgical instruments. Coming to phenolic compounds, phenol itself is toxic to skin and bone marrow. The phenolic compounds were developed to reduce these side effects but are still toxic to living tissues. These compounds in high concentration are protoplasmic poison and act by precipitating the proteins and destroy the cell wall. Lawrence and Block reported that their spectrum of activity includes lipophilic viruses, fungi and bacteria but not spores. Hence, they are approved by ADA for use as surface or immersion disinfectant. These compounds are useful for disinfection of inanimate objects such as walls, floors and furniture. They may cause damage to some plastics and they do not corrode certain metals such as brass, aluminum and carbon steel. Coming to aqueous quaternary ammonium compounds like benzalkonium chloride, these are most commonly used as an antiseptic. The spectrum of activity is primarily gram-positive bacteria. It is well tolerated by living tissues. It is not widely used because of its narrow spectrum of activity. According to the ADA Council on Dental Therapeutics, due to low bactericidal activity of these compounds, they are no longer used as a disinfectant. Coming to iodophore compounds, many studies have shown that they are very effective antiseptics. Iodine is complexed with organic surface active agents such as propyvinyl pyrrolidone, that is in the combination called as betadine or isodine. Betadine or povidone iodine is used at 7.5% weight by volume as surgical scrub, as 5% weight by volume as intraoral flushing solution and at 2% weight by volume as betadine gargles. Their activity is dependent on the release of iodine from the complex. The surface agent is film forming. This prevents the solution from staining clothes or skin. These compounds are effective against most bacteria, spores, viruses and fungi. These are most commonly used surface disinfectant along with hypochlorite. Concentrated solution have less free iodine. Iodine is released as the solution is diluted. An appropriate dilution is 1:2:3 parts of iodophore and distilled water respectively. Coming to chlorine compounds, the most commonly used chlorine containing compounds are hypochlorite solution as well as chlorine dioxide. The CDC has recommended the use of 0.005% to 0.5% sodium hypochlorite as an effective agent in inactivating HBV. It is corrosive to metal and very irritating to skin and other tissues. Coming to biguanide, it is most commonly used as chlorhexidine. It is a powerful non-irritating antiseptic that disrupts bacterial cell membrane. It persists on skin for a longer period of time and that is why it is extensively used for surgical scrubbing, neonatal bath, mouthwash and as a general skin antiseptic. Coming to operation theatre procedure, you have an antiseptic environment. The principle is to minimize bacterial contamination, especially in the vicinity of the operating table. The concept of zones is useful and must be employed. The outer and general access zone, that is the patient reception area, and the general office is a non-sterile area. Coming to clean or limited access zone, it is the area between the reception and the general office, the corridors and the staff room which connects the general area to the OT area. Coming to the restricted zone or the restricted access zone, these are for properly clothed personnel engaged in OT activities and the anesthesia room. The aseptic or operating zone, that is the operating theatre which has to be completely sterile. Coming to surgical scrubbing, the purpose of surgical hand scrub is to reduce resident and transient skin flora, that is bacteria, to a minimum. The resident bacteria are often the result of organisms present in the hospital environment. Proper hand scrubbing and the wearing of sterile gloves and a sterile gown provide the patient with the best possible barrier against pathogenic bacteria in the environment and against bacteria from the surgical team. The following steps comprise the generally accepted method for surgical hand scrub. Now we come to gowning. The first step is drying of hands after sterilizing your hands. Second step is picking up the gown. Third step is let the gown unfold. Fourth step is open to locate the sleeves or armholes. Fifth step is to slip arms into the sleeves. The sixth is to hold arms out and slightly up. The seventh step is the circulator pulls the gown on, as in you have an assistant who helps tie the gown to your back. Coming to the next step, which is how to put on sterile gloves after you put on your gown. The next step is pick up one glove with thumb and forefinger, pull the glove on the hand as in the image, slip partially covered gloved hand under cuff of second glove, pull second glove over other hand and pull glove up the gowned wrist. The fifth step is slip fingers of completely gloved hand under the cuff of first hand and pull glove to the gowned wrist. This is to prevent the powder from falling on the already gloved hand. The sixth step is gloving procedure is completed. Coming to the learning objective of today's presentation, when you are changing a dressing, removing sutures, or preparing the patient for a surgical procedure, it is necessary to establish a sterile field from which to work. The field should be established on a stable, clean, flat, dry surface. Once established, only those persons who have donned sterile gloves should touch the sterile field. Additionally, the following basic rules must be adhered to. The first step is an article is either sterile or unsterile. There is no in between. If there is a doubt about the sterility of an item, always consider it as unsterile. At any time, if the sterility of a field has been compromised, replace the contaminated field and create a new sterile field. Do not open sterile articles until they are ready for use. Do not leave sterile articles unattended once they are opened and placed on a sterile field. Do not return sterile articles to a container once they have been removed from the container. You will again make it unsterile. Never reach over a sterile field. You will again make it unsterile. When pouring sterile solutions into sterile containers or basins, do not touch the sterile container with the solution bottle. The bottle is not sterile. Once opened and first poured, use bottles of liquid entirely. If any liquid is left behind in the bottle, discard it as it has become unsterile by now. These are the references that I have gone through for making this presentation. Thank you, students. Have a nice day.